Good morning and happy Tuesday, everybody. Casey is away today. Hopefully, she'll be back this Thursday for another one of our chats. But before we get started, for those of you who aren't familiar with who I am, my name is Jessica Melnick. I am a registered holistic nutritionist, the founder of the Anti-Arthritis Method, the host of the Happy Joints Arthritis Solutions Group, and I help both women and men with various forms of arthritis get back to living life the way they choose to, not the way that they have to. So today I wanted to talk to you guys about the differences between osteoarthritis and rheumatoid arthritis. I haven't talked about this in a long time, but it is a question that I get asked often. And I think it's really important to know the difference because I know a lot of people I talk to, they know they have arthritis, but they aren't clear actually what form they have. So sometimes our doctors, when they're giving a diagnosis, will just say, yes, you have arthritis, but sometimes maybe we're in a state of shock or we're having a hard time processing the diagnosis because it's difficult to receive. And, maybe we don't take in the information they're giving us. And sometimes our doctors maybe don't give us as much information as we would like to have a full understanding of what is actually happening to us health-wise. So I wanted to go into the details and the similarities and the differences between osteoarthritis and rheumatoid arthritis because there's a very big difference in terms of how they're treated medically. But I also am happy to share with you that from a holistic alternative health perspective, there's a lot that we can do for both forms that is very similar and very effective. So, to get started, I guess one of the main difference, or sorry, I'm going to say the similarity first because there's a lot of differences, but one of the biggest similarities between osteoarthritis and rheumatoid arthritis is that the underlying core of arthritis is inflammation in the body. And inflammation is also the underlying factor in many other diseases such as diabetes, cancer, cardiovascular disease, Alzheimer's, dementia, etc. So to get started, I'm going to first describe osteoarthritis. So the main difference between osteo and rheumatoid arthritis is the part of the joints in the body that are affected. And also, osteoarthritis is the most common type of arthritis, and it is often referred to as degenerative arthritis or degenerative joint disease. And osteoarthritis occurs when the cartilage between your bones deteriorates over time. It usually starts on an isolated joint, and symptoms can be really similar to rheumatoid arthritis symptoms, actually. So while osteoarthritis can happen with age, it's not a normal part of the aging process. And left untreated, the cartilage wears down completely, causing the bones to rub against each other, which is very, very painful. This causes painful inflammation, stiffness, pain, and swelling. And over time, the changes to the bones between our joints can begin to affect our hands, our knees, our hips, or even our spines. So, for those of you who have bone on bone arthritis, that is where your cartilage has deteriorated to the point that your bones are rubbing together. It is extremely painful. Now, some of the risks of developing osteoarthritis are determined by a number of factors, including age, gender. So women are more likely to develop osteoarthritis. Obesity is also a risk factor. Having injuries or a history of contact sports, accidents, things like that, where you have previous injuries, those joints that were affected can develop into osteoarthritis or be more susceptible to developing osteoarthritis. Things like your genetics, having a bone deformity such as malformed joints or a defective cartilage. There is a small population that has defective cartilage, which is a genetic component often. It's a little bit more rare though, and also having metabolic diseases, including diabetes or metabolic syndrome, is also a combination of having blood sugar management issues and heart issues and a few other problems. Now, the tests for osteoarthritis include x-rays, MRIs, joint fluid extractions, doing a scope of the joint, a synovial tissue biopsy, synovial fluid analysis, and ultrasound. And conventional medicine treats the inflammation with harmful medications, and it does not get to the root cause, unfortunately. So, however, this is good news. We now know that osteoarthritis is part of metabolic syndrome and a digestive issue. So it can be reversed by changing diet to remove inflammatory foods such as gluten, dairy, and processed sugars. So there is hope out there. There is something that you can do. Now let's go into rheumatoid. Now there are a lot of similarities between the symptoms of rheumatoid arthritis and osteoarthritis, at least when you're first developing it. But like I said, the difference between the two is that rheumatoid arthritis affects a different part of the joints than osteoarthritis. And rheumatoid arthritis is considered an autoimmune condition that occurs when the body begins attacking healthy joint tissues, mistaking them as foreign invaders. And the body attacks the thin membrane surrounding the joints, allowing fluid and immune complexes to build up in the joints and cause significant pain. So, normally, these immune complexes filter out of your blood on their own, but when there is a buildup, they tend to settle into different joints and cause local inflammation and tissue damage. And when these immune complexes build up in the joints, they can cause pain and swelling, which is characteristic of rheumatoid arthritis. And typically, rheumatoid arthritis starts in the smaller joints, such as hands, fingers, and toes, and it progresses to larger joints like the wrists, ankles, knees, and hips. The pain and swelling is usually on both sides of the body or in bilateral joints. So, both wrists, both hands, both elbows, that sort of thing. Whereas other autoimmune forms of arthritis, such as psoriatic, can be asymmetrical. So, maybe you have one ankle that's affected or one wrist that's affected. Also, if someone in your family has rheumatoid arthritis or any autoimmune disease, you are more likely to develop RA in your lifetime. So, if you've already been diagnosed with rheumatoid arthritis, then you are 3 times more likely to develop a second autoimmune condition. And additionally, studies using identical twins found that genetics only account for about 25%, and environmental factors account for 75% of autoimmune conditions. So that's pretty wild. But the good thing is that 75%, meaning environmental factors, means you have so much more control than maybe you have been led to believe over the progression and the how your disease presents itself. I also wanted to say another side note too about having being 3 times more likely to develop another autoimmune condition if you already have rheumatoid arthritis. So I see a lot of people, a lot of my clients have diagnoses of both rheumatoid arthritis and Hashimoto's, which is a low functioning thyroid, but it's an autoimmune condition. So I hear from people all the time, and they say, I have a low functioning thyroid, and I've been on medication forever. And if I ask sometimes if they have Hashimoto's, they're not sure. So I also recommend that if you do have a low functioning thyroid, ask your doctor, is this Hashimoto's or is this just simply low functioning thyroid? Because there is a difference. Hashimoto's is an autoimmune condition. But the beautiful thing about autoimmune conditions, even though you're more susceptible to develop more than one if you already have one, is that you can address them the same way with dietary and lifestyle changes. Now, let's go back to how rheumatoid arthritis is diagnosed, because lots of times I talk to people who don't have a clear diagnosis or they've never been diagnosed. They don't know how to go about doing that. And I know sometimes it can be a lengthy process if you're waiting to see a rheumatologist. I know with COVID, there was a lot of delays in medical treatment as well. So hopefully things have started to turn around a little bit, but it can be a bit of a process to get a clear diagnosis. And the diagnosis for RA is based on a combination of the symptoms you're experiencing, physical exams your doctor is going to perform, and blood tests. So typically, your doctor is going to order the following blood tests to look for significant signs of inflammation as well as autoimmunity. And an x-ray of the affected joint or joints may also be ordered for a closer look. So some blood tests that are often taken to determine whether or not you have rheumatoid arthritis or another autoimmune form of arthritis, like psoriatic, for example, is a blood test called anti-nuclear antibodies, or ANA, rheumatoid factor, anti-citrullinated peptide protein antibodies, which is also known as anti-CCP, erythrocyte sedimentation rate, otherwise known as ESR, and high sensitivity C-reactive protein, or cardio-CRP. Signs of rheumatoid arthritis. I think a lot of you are familiar with this, but just to be a little bit more specific. Also, the severity of symptoms can vary from person to person, but these are the most common symptoms: having joint pain, swelling, tenderness, stiffness, and deformity in the joints or fingers. Fatigue, that's a huge one. Also, anemia. And if you have anemia, which is like a low hemoglobin, low iron, you are going to be really, really tired. And it's very common with RA and other autoimmune conditions. Unintentional weight loss and lack of appetite can also be characteristic of RA. Having nodules or stiff bumps under your skin, in your fingers is a typical place to get nodules. Having frequent urinary tract infections, so having an immune system that's not working properly. Also having fever. So fever is another sign of inflammation that is active in the body. And conventional medical treatment for both rheumatoid arthritis and osteoarthritis is often medication. Doctors often recommend lifestyle modifications such as going on a diet and exercising more to lose weight to take pressure off the joints. Physiotherapy is often recommended, and sometimes surgery is also recommended. Unfortunately, meds over the long run can actually contribute to the source of arthritis, though, and can contribute to other health problems. So this is really important. This is a really important reason to look into alternative ways of managing this. I'm not saying that you should just go off of your medication or experiment in any way with your medication if you are taking medication, because that is not safe. We can work with you from exactly where you're starting from, whether or not you're on 5 medications or 1 or anything else in between. So, although I know Casey and I have talked a lot about how we focus a lot on autoimmune conditions, in my case, autoimmune forms of arthritis like RA or psoriatic arthritis, we talk about this a lot. But our approaches that we use are also very effective for osteoarthritis, even though it is not considered an autoimmune condition. And the reason it works is because it decreases inflammation in the body, it improves digestion and gut health, it gets blood sugar under control. And these are all things that are necessary to get osteoarthritis under control. And also, when you are decreasing inflammation in your body by eating the correct foods, things that you're not going to be sensitive to and that are unbeknownst to you, causing irritation of the gut lining and other issues and an overactive immune system. And you're also making some recommended lifestyle changes to reduce stress as well. That's a huge one. Weight loss actually can become possible. It's really, really hard for our bodies, if they need to lose weight, to actually go ahead and do that if we have a lot of active inflammation in our body. So when we have active inflammation in our body, like we are experiencing arthritis symptoms, our body is in survival mode. It's working really, really hard to manage those symptoms and bring that inflammation down. So it's really hard for it to focus on releasing excess weight, because that's just not our body's priority in that moment. So when you bring down the inflammation in the body, then our body is able to release excess weight, because it's not so hard working so hard to try to protect us. So the solution is not always to eat less and exercise more, even though it sounds very simple. I've also worked with many clients who have osteoarthritis, and although we can't reverse permanent joint damage, these clients still experience significant improvements in mobility, reduced pain, and inflammation. So If you would like to learn more about this, I would love for you to attend my free masterclass tomorrow night. It is going to be at 7 p.m. Eastern Time, which is 5 p.m. Mountain Time, 4 p.m. Pacific. If you are in Australia, it will be on Thursday, November 3rd in the morning at 10:30 a.m. Australian Eastern Daylight Time. So, like I said, if you want to learn more about these details and what you can actually do about your arthritis symptoms from a nutritional and lifestyle standpoint, I would love for you to join my masterclass. I'm going to attach the link to register for the class below this post. You just have to click on that link and register there. Like I said, it's free. You'll get some reminders as well of when the class is starting. So if you're not able to make it, it will be live in the Facebook group. So you're able to watch the replay the next day or later that night. So I hope this was helpful for you. If you have any questions about these differences between osteoarthritis and rheumatoid arthritis or other autoimmune forms of arthritis, just comment below and I will be happy to get back to you. And I will be back here on Thursday to chat with you guys about more things arthritis. So I hope you have a wonderful rest of your day and we will see you soon. Bye, guys.